Hey guys, welcome back to The Pathway, a podcast brought to you by Pure Psychiatry of Michigan. My name is Taylor Henrik. This is my buddy, Sarang Patel.
What's up, guys?
Hey, so we're going to be talking today a little bit about ADHD. We're going to be talking about it in the school setting, in the home setting, and talk about how ADHD can be tackled, treated, and overall better covered.
Get it, got it, good.
So we kind of ended the last episode on a high note. We were talking about ADHD, talking about the schools, talking about different various ideas surrounding attention deficit, academics, and different pursuits. I felt like we were about to get into something big.
Hot topic.
Hot topic. Not a hot pocket. Hot topic.
Hot topic.
Hot pocket.
Hot pocket. Yum.
But I think we dive right in on this. I think this is something that we can talk about for a long time. So
back on track. ADD.
Yeah, there we go. Good example. Now, as we get into this topic, where do we want to start? Do we want to talk about in the schools? Do we want to talk about these clients that are presenting to us and some of the concerns that are brought up by parents or other providers? Or do we want to talk about ADHD as a whole?
I got a controversial idea for it.
Controversy.
I'm going to hit you with it, right? So, common thing. We see a kid, right? They're in school, obviously, whatever the situation may be. Grades are struggling, right? Mm-hmm. Just like myself when I was a kid, grades are struggling. School says it's ADD. Mm-hmm. Teachers feel like, hey, they're having outbursts or, interrupting class. They're joking around, whatever it may be. They're 8, they're 9, they're 6, whatever it is. They're 10, right? You talk to the parents, and based on maybe interpersonal family trauma or drama, right? There are things that are triggering possible anxiety or possible depression or trauma, PTSD, right?
Okay.
Parents divorce, whatever the situation may be. So you clinically, as a clinician, you feel like it's depression or something else mental health related that's leading to inattention, all these issues that may be causing outbursts, whatever it may be, attention-seeking behaviors. But the school is feeling like it's ADD only. Mm-hmm. What do you do? I know.
It's an everyday question.
Putting you on the spot.
Absolutely. I can tell you that over the course of the last month, I've probably had a half dozen to a dozen similar such situations via psychiatric evaluations. This is very common. This is something we see all the time. Anybody who treats under 18 and arguably over 18 is going to have this type of situation come about, right? Mm-hmm. As a clinician, we have to be able to weed through the information and make that clinical discernment of what we feel is the underlying cause, right? There's a lot of intersection between mood disorders, anxiety disorders, and inattentive or hyperactive disorders. Arguably, the word that I always use is impulsivity. Now, just because someone else feels as though it would be attention deficit, I always want to do a true and full evaluation myself. I feel confident diagnosing attention deficit. I feel confident making a formal ADHD diagnosis, especially when it's manifesting in those preteen or teenage adolescent years. So my thought process to your question is, you got to dive in deep. I mean, you got to diagnose based on criteria. You need to fully evaluate. You need to be comprehensive. You need to gather medical history, family history, and all the appropriate other histories to be able to make that call. Where are the symptoms coming from? What is the origination of the symptoms? What are they? When are they manifesting, right? And do they go away at other times of day? Or are they all the time, right?
Right. Because grades itself, right? Here's one thing I say for the general public, right? And maybe a lot of clinicians as well, or therapists, or whoever may be out there. When you talk about ADD, or ADHD, whatever, we're treating them almost the same to a certain extent, right? I would argue.
Yeah, of course.
It has to be affecting the individual, kid or adult, in two different aspects of life, two different areas of life, whether that's school and work, or school and home life, or home life and work, whatever, put your little, however you want to put those combinations together, in two different aspects. It has to be distressful. I always give the argument, I can watch the Lions play for 4 hours straight and not move and just stare at the TV and not even have any issues. I can't do that while reading a book that I don't enjoy.
Correct.
That doesn't mean that my ADD is uncontrolled, right? So we have the issues with kids where it's in particular classes, maybe they don't do well in. Mathematics is an example, but everything else is pretty good. That doesn't mean it's ADD either, right? So sometimes I think that we not as clinicians, but I think even in the schools, right? We force this aspect of you need to put them on a medication for it, where I'm not saying they should or should not be on a medication without seeing the person for sure, talking it through. Every case is different. But we should implement IEP programs in school easier. And I know resources are limited, and that's a whole other hot topic, right? But we should also then talk about therapy. Therapy or counseling or education on coping skills and ADD are never discussed, I feel like. I think it's always ADHD, or, I'm using them inversely, right? ADD or ADHD. We always say, if you have this, ADD or ADHD, you should be on a medication. It's not, if you have this, you need to be on a medication and you need to use your coping skills. Sticky notes, reminders, whatever you want to say, alarms, like all that kind of stuff. You still have to implement that stuff, right? Our partner, Dr. Mean, said, and I liked how he said this too when we were talking about when we were talking big group. The goal should not be going into taking a medication, especially with kiddos in the schools, right, with ADD, to have them say, you need to be on this medication for the next 30 years. Mm-hmm. First of all, I always tell patients this too, you don't want this to be a crutch to your functionality and a crutch to your survival. Don't lean on this medication as a stimulant, right? We talked about addiction issues, being a crutch to that. You need to implement earlier these therapeutic modalities, reminders, or whatever it is, coping mechanisms that you could do, but we don't talk about that enough. So I know resources can be challenging and insurance barriers make it harder to do that too, obviously. But if you can get that resource, which is available to some people, we don't even talk about that too much. I know I rambled on there a little bit, but
no, it's a great answer. I want to pick at a few things that you said in a positive way. The first step should always be, for someone who's under 18 or over 18, arguably, lifestyle modifications, right? What are you doing in your setting to limit your setting? Are you avoiding distractions? Are you allowing yourself to listen to music, read, have a show on, and then also try to cook? Are you getting screamed at by kids on a Zoom call and also trying to jot down notes? What does it look like? What's your setting look like? What steps are you taking to try to limit or avoid distractions? Secondarily, are you being intentional with your day-to-day actions? Are there different things that you can change that might be able to help you hone in on what you're trying to do? I don't view inattention or having issues with distractibility as a cop-out, but I do think all of us, to a certain degree, I know all of us, to a certain degree, experience symptoms that could look like inattention. We all zone out. After a long day, I zone out. Anybody is going to have a hard time being locked in all the time. To your point about obligation versus doing something voluntary. If I'm told to go read out of a book that I don't want to read, it's going to be hard for me to stay on task without checking my phone, without getting up and moving around, without going to get water, whatever, because I need a distraction. But conversely, if it's something that's sport related or something of my interest, I'm going to do it. Where does that line for an adolescent or pediatric patient become hyper-focus? Because hyper-focusing can be and is recognized as a symptom of attention deficit or ADHD. So where's the line of, yes, they can sit still, but it's not hyper-focusing? How do we discern that?
Got me good on that one.
I'm asking because it's hard. It's hard because you can have a kid, the classic example is video games, right?
Right.
They can sit down, they're going to play video games, they need to go to bed at 8. They're going to be playing video games till 11 if nobody stops them. They're going to be playing video games till 2 a.m. if no one stops them.
Right.
Hyper-focusing on something that's interesting versus just having a healthy balance or a moderated amount of consuming something.
Yeah, I mean, when you enjoy something, and especially as a kid, we've all been there, there is a level of hyper-focusing or hyperfixation that will be there. I mean, like you said, if you enjoy it, you're going to keep doing it. But you have to look at it like, is it distressful? Now, of course, you could argue that, hey, playing video games till 1 a.m, they're not sleeping, it's distressful, they're going to be late to school, they're going to be tired, it's distressful, sure. But you have to look at it that, is that actual ADD, is it again affecting them in multiple areas? Because you can't just say someone is hyperfixated and now it's ADD or ADHD. You have to have other criteria as well.
Correct.
It has to obviously be affecting you in multiple avenues as well. Hyperfixating in multiple avenues, I would argue, versus just one thing. Mm-hmm. I think so.
Absolutely.
And it's a case-by-case basis, right? I mean, we're not out here saying that we got the secret sauce figured out, that we know how to delineate every single person, whether it is ADD or ADHD or not.
Yeah.
And I tell parents all the time, I'm not really sure right now. But I think that that's the problem that we have in mental health, right? It's almost like when you do an evaluation, and I'm going to go off topic here a little bit.
It's okay.
When we talk about a mental health, especially with us, right? We always say, and we've heard people say, I need an hour and a half. I need 2 hours for an evaluation or an hour for an evaluation. I always argue that you could have 5 hours. And I tell the parents that too. We could spend a whole day here, but I may still not know the answer as far as what it is today. Mm. But you don't have to have every single answer on every single diagnosis at the first intake when it comes to mental health. Ideally, you'd like to know what ideal you're going on, what path you're going on. But it's okay, I would argue, in mental health to change a diagnosis as you get information. It could be really a good day. It could be a really bad day. Today, the kid could be talking about it because, they just had missing assignments that were due last week, and then now they haven't implemented coping skills. Now we get it handled. And you might say, well, it really wasn't ADD. It was just that they just needed general coping skills. You know what I'm saying? So you can evolve. The diagnosis can change. And I think that in mental health, we sometimes forget that. It's almost like, hey, today's your evaluation. Today, we're going to decide your diagnoses. And it's not really like that, So the hyperfixation aspect, what I'm getting at to your question is that it can evolve. So I might think today it is ADD because they're hyperfixating, and then in a month say, well, you know what, really probably wasn't ADD. If you look at how they're hyperfixating, it's kind of shifted, or it was just that, they needed good rules and good standards in kids, right? As far as like good things to follow, rules to follow at home.
Behavioral modifications can
said.
absolutely adjust the expectation. What if that hyperfixation was actually the kid was ruminating or dwelling on something because they were so anxious they couldn't let it go, right? There's overlap. There's mimicking symptoms between different disorders.
Right.
And that's where being a clinician, it's our job to discern that. So I agree with the idea that I may not have you pegged perfectly. You're a circle and I'm going to put you in a circle within our evaluation. Because I tell my clients, I need data. I need multiple visits with you, whether you're a pediatric patient, an adolescent, or an adult. Let's work this out. If you extrapolate that onto other mental health disorders, a lot of times it's difficult to discern a mood disorder in one visit, right? Describing mania for the layman, for anybody who's not familiar with mental health, is not going to be an easy challenge. And even if you ask the appropriate investigative questions, it's still hard to discern that diagnosis right off the rip. So I tell them, look, my concern is not you have a mood disorder and putting you in a box, keep you there, let's treat you with meds. My concern is let's treat your symptoms. I'm listening to your symptoms. I'm listening to what you're telling me, and I want you to be a part of this care. Let's figure out what your needs are and put that onto ADHD. Let's talk about, hey, is there hyperactive component? Okay, how can we help that? Whether it's behavioral modification, it's therapeutic measures, it's an ADHD workbook, it's listening to a kid's podcast, whatever it might be that can help those symptoms, or is it inattentive? Do we need to limit the setting? Do we need to implement a 504 and IEP plan? What can we do in the school setting and at home to help this individual thrive, right?
Yeah. You hope the schools can give support, right? I mean, you hope that there is, we know there's a lack of resources in schools. I mean, you've talked to anybody that works in the school system, they're already like, hey, classrooms are no longer 25, it's 35 kids. There's not a social worker sometimes in every school. It's like one social worker. We have a friend, obviously, who's a social worker, right? Congrats today. We have a friend who's a social worker, obviously, in the school system, and, she has to rotate down between multiple schools, right? Which is like, if you think about it, that's almost like a teacher having to go to multiple schools to teach the same class. How does that make any sense, right? But we know resources are limited. So you hope the school provides enough resources for an IEP, for a program, for skills for kids. But if not, it's our job as parents, right? Us as parents, us included, to then recognize that, hey, we may not be getting enough resources in school. We tried, we can. We need to seek external resources. And that may also be included that me as a parent, I don't have ADD or ADHD, right? My kid does, but I need to learn about what it is and what coping skills we can utilize so then I can help to implement those at home as well. Because you're not always going to be able to, unfortunately, right? The way mental health works is you're not always going to be able to get the resources at the grasp of your fingertips when you need them.
Right.
And we understand that, right? We say, Pure, we're here to give you support. We do the best we can do to increase access, and we're going to keep working on that. But we know that there are still patients out there that still don't have access, that are in a super rural area, that maybe don't have insurance, that maybe don't have transportation, whatever the issues may be, and we're going to keep striving to get to you. But until then, and if we can't, right, we're trying, then we need you to also learn those skills as well.
Absolutely.
For the betterment of your kid.
Education of the adult, education of the individual, ourselves. We're always learning. And, to your point, it does come down to resource allocation. And unfortunately, some of the IEPs aren't adhered to, not casting blame or like saying that anybody's coming up short. But a lot of times parents will say, hey, I have an IEP built in for, so-and-so, and so-and-so's needs are not being met at the school. But after school, I'm taking steps to help them. They come home, maybe they're a little bit frustrated, they're venting all their emotions off. I give them a little bit of time to chill and just take a little bit of time when they get home, feed them, give them a snack, hydrate them, and then we talk. We talk about how the day went. We tackle whatever homework might be needed. Where it gets hard for the ADHD individual is there's a couple traits that come along with ADHD, right? I think it's safe to say that a lot of ADHDers are picky eaters, right? That's something that I see correlative in some cases. I'm not saying in all. Sleep is sometimes a struggle, so we have to take that into account. And also, how many patients/clients do you have that are involved in after-school activities?
Yeah.
A lot. So that after school isn't usually just school ends at 2:37, they're home by 3:10, they chill for 50 minutes, and then they're tackling their homework.
Yeah.
That's not the norm. The norm is so-and-so's in soccer practice, and then right after that, they went to gymnastics, and then after that, they went to vacation Bible school, and then they came home at 8 p.m. And it's like, this is a 9-year-old. These individuals are very busy, and we all did it. We were all there. But it is a lot. It's a lot on these individuals. And I totally believe in extracurricular activities as being a additive. It's a good thing. I always enjoy and hear that my clients are involved in groups, committees, leagues, councils, sports, whatever it might be.
Being a stud athlete that you are.
It made a big difference in shaping who I am.
It did, right?
Your friend group, your individuals, the people that you spend time with, it shapes who you are as a person. So if that individual is just going home and has no sociability, has no social group that they spend time with or latch on to, it can also cause other issues.
Yeah.
So how do we toe that line? How do you help that individual, whether it's ADHD or something else? Where do we find that balance in like the school day versus after school day and allowing this individual to just have a little bit of time so it doesn't negatively affect their mental health?
I mean, I think that's a discussion, and I think I had this with one of the reps at the office last week. We're just talking. I think that it's a battle every parent deals with, right? Especially if your kid is athletic or is good at band or is good at whatever it is, language, wants to take 3 languages, whatever the situation may be, right? And they want to do this, then you don't try to hold them back, obviously, but then you also, as a parent, have to put in regulations that, hey, we can't do all 3 sports at the same time right now. We'll have to space them out, right? And you have to kind of put those rules, barriers into place because for the betterment of your kid, but also for the betterment of your mental health. Maybe, for instance, we've seen this. I know I'm going off on a tangent again, but parents are excessively stressed because they're trying to meet all the standards for finances, for the kids' home life, for everything after school, and their mental health is deteriorating. You can't be a good parent if it's at the you're doing all these things for your kid if it's deterring your mental health. You can't be the best parent you could be. So it's a family discussion. It's a family approach to what is manageable. Everyone's situations are different, both financially, both time-wise. Like if your work schedule is 3rd shift, it's different, right? Or 2nd shift, whatever it is. You might have to miss certain things. Or if you're a single parent, unfortunately, then you may not be able to do all these things because you have to have a job. All this kind of things come into play. So you have to look at what's okay for your family as a whole, for your nuclear family and for the kid. Mm-hmm. You want to push your kids to succeed, totally on board with that. No one's saying, hey, don't push them. But you have to be careful not to push them to the extreme. I think we always talk about that, especially in brown culture. I can bring it up, but I think in our culture is always like, school. And the argument's always like, are we pushing our kids too much for Kumon after school and math and language and this and the religion class and whatever it is, and then try to get them into a sport, even though we're not that athletic, trying to push them into a sport. But realistically, you have to put that barrier on there to understand when is it too much, right? I think hopefully, we talked about the previous episode that generational things have changed. I think our generation is a little bit better understanding you don't push them too much. There's that work-life balance, we call it, right? Which I'm whatever about to a certain extent. But there's also that school-life balance, I think, that needs to come into play there too.
Absolutely.
Because if anything's changed throughout all the years from our parents' generation, I would argue that life has sped up. The day-to-day processes are faster. Mm-hmm. You can now work remotely. You can now have Zoom. You can now have work meetings when before it used to be when you were out of work, 20, 30 years ago, some people, every job's different, typically out of work. Now you can have a Zoom call after hours. Now you can work from home, so you are mixing now work and family life together after hours. So there's less separation. But the days have sped up. So if we don't do things to kind of help slow it down sometimes and kind of put those limitations, then it just kind of becomes overwhelming. And it's like a tumbleweed effect. Once it gets rolling, you can't just cut things off sometimes.
It's a great point. It's a blurred line now. Work often follows you home or it is already on you before you even start your day, right?
Yeah.
I received text messages this morning before I had the chance to wake up my daughter, right? And that's just part of it. I love my life and it is balanced. It's chaotically balanced. It's in a good place. I also want to harken back. I love using that phrase. I want to go back to a conversation you and I had before where we talked about
Harken back.
work-life balance. Say it's school-life balance. Say it's work-life balance. And I then saw, it was so coincidental. You and I were talking about work-life balance. And then I saw something on a social media platform that was like, not screw life balance, work-life balance, but it was like, if you're not unbalanced, if you're not uncomfortable, are you really striving to be the best version of yourself? Like, it's good. And I'm big on work-life balance. Like, I truly believe like I have to shut it off so I can spend time with family, so I can do something for my own mental health, right? To preserve my individuality and to be able to be the person that I need to be for those in my life, whether it's at work, at home, my family, etc. But I also want to feel a little bit uncomfortable because it lets me know that I'm about to take that next step, right? Like a growth step. I'm going to push a little bit harder. I'm going to work a little bit longer. I'm going to stay up a little bit later to get something done. I'm going to wake up a little bit earlier to get something done so that next day I took a step forward. Would you agree?
Yeah. I mean, for everybody, again, the situation changes, right? So you can do that if some of the external life stressors aren't as severe at this time, right? Then you can say, yo, let's get out of my comfort zone. So financially, so business-wise, so personal-wise, health-wise, whatever you want to say, can grow. Let's get out of my comfort zone. But there's always a time, right? I mean, I feel like my dad always says, right? Right time and right place kind of thing, right? You can't say, I'm going to push myself or push my kids to be super uncomfortable so they grow when there are severe external stresses right now at this time.
Yeah.
You need to sometimes step back and say, all right, we're going to get out of our comfort zone, but first let's tackle this and then we can do that, right? I mean, this is just like, we're just talking here now. It's easier said than done. And we go through the same things ourselves. We talked about it, right? But it's a true thing that no one really ever mentions that, hey, like you have to, you scroll through Instagram, you look at all these like, statements and all these reels that are obviously like motivational things, right? You want to follow those things. You want to do those things. You send it to your friends. You save it. You say, I'm going to do this stuff. But there's always a right time to do those things.
You're right.
Right? So, and my dad always says, you look at someone next to that person's maybe more successful financially, may have a bigger family, bigger house, better car, whatever the situation may be, materialistic stuff, or physically more fit, whatever it is. You strive to be better as best as you can do, but you have to understand that what is your time and your place right now, right? You can't just say, I'm going to be better than that. You can't always want to be better than somebody else. You have to do what's better for your family at that time. But if you don't separate timing of trying to achieve things, then I think it just becomes overwhelming. And forever, you chase life trying to be something when you may not live in the moment then at that point, right?
Absolutely.
I mean, I guess I kind of ramble on about it because we talk about this personally in our levels, where we're like, hey, when are we going to slow down and kind of smell the roses a little bit and when we want to do things, right? So we're both motivational and we want to try to get as successful as we can get, both financially, family-wise, whatever the situation may be. But sometimes we also talk about it that, hey, should we chill a little bit here for the next couple months and see where we're at and then kind of do that, right? So
in the true inattentive spirit, we've veered a little bit away from ADHD. I want to bring it back to that topic for a moment. For those out there who either personally are in the midst of trying to understand their own attention deficit, or for the individual who may be tuning in today who is supporting someone else with ADHD, what would be one piece of advice that you would give, let's say first for the person who has ADHD, hasn't received treatment, never been on medications, hasn't been engaged in therapy? What would you ask of that individual? Or maybe what kind of guidance would you give them in terms of not just go get care? That's an easy answer. What would you say that they could do now to improve their day-to-day life? Truly putting you on the spot.
yeah, for real. I would say you have to write down, and I'm looking at it for like myself, for instance, I'm just going to say what I would do.
Okay.
You'd have to write down what things in your life are necessary, what things are unnecessary, and what are your wants and what are your needs.
Okay.
So if you feel like you have a lot of stuff on your plate and it's a lot of stuff to manage, then you have to kind of say, what can you remove and maybe reintroduce at a better time or at a time when you feel like you're more comfortable and able to handle it, right? I think that's the first step. And it's very basic. It sounds like really cliche, but really if you don't do that, then you don't know you need to know what you need to survive. No one's out here telling you don't go to work when you got to put food on the table. Like I understand the concept, right? Pay rent. So that's a need. It's not a want, it's a need, but it's a necessity. So you put that in that column. And then if you can remove those external things and you see where you're at there. So let's say you're not seeking care yet. You're saying, let's try this first. If you do that and you remove some of those external things and now you're able to handle it, you kind of got your answer. It's when I want to reintroduce things that I want to do or things that I want and are not necessities, you slowly introduce them and see how you handle them based on your life situation, based on your life stressors. From there, if that doesn't work, right, if you remove those, and I think if that doesn't work, then you can ask for help. You can ask friends or family, how do they cope with things? How do they manage that? Try to learn some skills. You try to put some skills into place that could be helpful, reminders, whatever coping mechanisms you can use. You can Google skills that could help with ADD or ADHD, right? And you try to implement those. If that doesn't work, I do think then you do reach out. Even if that's a prescriber, even if that's that you don't want to take medications, they can still give you tips and tricks. And you can go to the prescriber and say, hey, like, I don't want to be on a stimulant. What options do I have? Or, hey, I do want to be on a medication. What do you think is the best option for me, right? Like, if you go into that with that open mindset about all options, not just, hey, this is what my friend takes, can I take that, right? I think you get a better understanding of all the options that are available for you and see what works.
Good. Your answer is phenomenal. I think it boils down to prioritization and having a cascade and an ability to prioritize and compartmentalize what is important, what's not necessary, taking out those external stressors and just identifying what are my core needs on a day-to-day basis. I think your answer was actually twofold. I think it answered both of my questions, whether it's the individual themselves or whether it's someone who's supporting an individual with ADHD. It's important to be able to boil that down to a base level and then build up from there. We can always add on external things like therapy. We can always add on medication. We can add on the ADHD handbook. But let's, at its core, let's get down to brass tacks and figure out exactly what is a want, a need, a desire. What's my running to-do list look like? I appreciate that answer a lot. I think that hit the nail on the head.